Telemedicine supports long-distance clinical healthcare, patient and professional health-related education, public health, and health administration through video conferencing. Telemedicine kit is one of the components of the telemedicine. This kit is portable and easily carried on wheels, and due to this, patients' traveling costs can be reduced. This kit is made by Pelican case, which makes it unbreakable. The kit has a notebook and a solar panel, medical devices, and a battery through which devices are charged. The devices include blood pressure monitor, glucometer, thermometer, fetal Doppler, and urine analyzer. There is also space available for storing the consumables depending on the number of patients to be covered. This kit has solar panel that is charged up to 4 hours, which will allow battery to charge the devices, through which we can capture nearly 200 patients' readings in a day. Telemedicine kit is a one-stop shop to get the medical expert services and accessible to rural patients who are in remote locations at an affordable cost. Telemedicine system users are nurse or health worker, doctor, and specialist. This solution is easy to use with very minimal training, which you can see in further video. The solution is also available in offline mode to ensure non-disruptive operations in case of connectivity issues. Data collected then would be uploaded to a central database server upon internet availability. I am now logging in as a nurse in online mode with the user credentials that are assigned to the nurse. Nurse or health worker role includes able to obtain a diagnosis and begin treatment quickly for the patient, and also administer medication in remote location under the direct supervision of doctor who may be 100 miles away. Nurse captures patient's demographic information and also billing information to register a patient. Nurse takes the chief complaints of the patient, such as abdominal pain, abdominal distension, and also captures history such as past history, medical conditions, which will assist the doctor in evaluating the patient. Nurse can capture patient vital signs such as BP, temperature, ECG, SpO2, pulse, through integrated medical devices. Nurse can also capture other test results such as urine test results, HIV, fetal heart rate, and malaria, even in remote locations where there would be no diagnostic care centers. In future, we can integrate to any other devices such as X-ray, weighing machine, dental camera, etc. for cardiac, gynecology, and for such many other specialties. Nurse then send the patient's clinical record to doctor for consultation by pinging doctor. If required, she'll have the video conferencing with doctor, where access to doctor has become easy for a patient. Nurse can also bill the services and consultation service that has been acquired by the patient. Nurse can also print the prescription and bill the drugs that are being suggested to the patient. This is the doctor login screen, where doctor role includes patient complaints evaluation and seeing the vitals or suggesting the appropriate medicines and tests. This is the personal pool and the patient pool. Doctor accepts a patient from the patient pool which has been requested by the nurse. Doctor then reviews the patient chief complaints, history, and then the vitals of the patient. Here we want to discuss our solution strong point, that is access to the patient history and demographics on demand with dashboards and analytics. Doctor can also chat with the nurse and can initiate a video call to see the patient and assess the patient medical condition. Superior quality of voice and audio communication with multiple participants, video conferencing is possible where a specialist consultation is required. Doctor suggests plan of care such as investigations that need to be done by patient and medicines. For example, laboratory service, blood culture aerobic. And doctor can also suggest drugs that need to be taken by the patient. And then doctor updates the clinical record and sends the plan of care back to the nurse, and doctor ends the call. This is about the doctor part of the telemedicine. Video conferencing facility is a unique feature of the telemedicine solution, which allows the doctor to view the patient and ask for any additional details as needed. Here, through video conferencing, the distance between the doctor and patient has been reduced, and patient can easily access to the doctor through just a video call. Through the video call, doctor assesses the patient's condition and also asks the patient regarding the pain or the medical condition that doctor wants to know about the patient. Then doctor and patient will have the video call and discuss the symptoms of the patient. After assessing the medical condition, doctor can prescribe the plan of care by switching over to the plan of care screen here. The video conferencing is configurable based on the resolution of the video to suit the bandwidth that is available. In cases of low bandwidth, an audio call can be done instead of a video call. Doctor can update plan of care during video conferencing as it is part of the same application. Doctor and nurse can have a peer-to-peer connectivity video call with a minimum bandwidth of 500 kb per second. Then doctor will end the call after assessing the patient's condition. Application is integrated with the following devices. This is ECG dual-LED device through which patient's ECG can be captured. The device can read from 12 LEDs, but for the purpose of recording, we are using only one LED. The screen records the waves from the device The doctor can decide at which interval to record based on which the corresponding graph is stored into the application. Similarly, this is fetal Doppler, which can be used to measure the pregnant woman's fetal heart rate. This is a Bluetooth device which is integrated to the application. Data from the device will be transmitted to the application via Bluetooth. This is the 135 is the fetal heart rate that has been captured from the device. This is urine analyzer where patient's bilirubin, blood, protein, pH, VC, etc. can be tracked. The strip shown is treated with the patient's urine, which is then placed into the device. Once activated, the readings from the device are captured into the application through Bluetooth. Just click on the urine analyzer icon on the application. Then we can have the readings from the device to the application. These are the readings that has been captured from device. This is ear thermometer where patient's temperature can be captured. The device is placed on the patient's forehead for taking the reading. Once the device has been beeped, the reading is ready to be transferred to the application manually. Like 97.1 is the reading which will be entered into the application. This is the blood glucometer to capture the patient's sugar levels. Normally, this will be used with a lancet which is used to prick and a strip which will use to collect the sample blood from the patient. Here we are taking the existing blood levels of a patient from the device to capture into the application by manually. 118 is the reading of the patient that has been entered into the application. Next is blood pressure monitor to capture patient BP level. The cuff is placed on the patient's left arm. Once operated, the device will capture the patient's diastolic and systolic readings, which can be transmitted to the application manually. Can also record the position of the patient, either sitting or standing. These are the readings that have been captured into the application. Telemedicine solution is created with the inputs from expertise healthcare and technical professionals having over 3 decades of experience in the African healthcare industry. This is about the telemedicine solution.